So welcome everyone. Thanks for taking some time out of your Thursday morning or afternoon, depending on where you are. You may have talked to me last week, and we were talking a little bit about swimming and rowing. So today we'll follow up on the other uh, sports that are involved in the tech try, cycling and running. Talk a little bit about that. I'll do a little bit of introduction just for those of you who maybe didn't make it last week or haven't had the opportunity to see the recording. So similar outline to what we went through last week. First, we'll start with some general principles, then we'll get into both sport-specific technique pointers, how do you do it well, and what are the sport-specific injury risk factors that really we can modify. So here's a picture of me. I'm a big cyclist, so lots of bike racing in my past, and hopefully lots of bike racing in my future. And so just a little bit more about me. I'm a doctor of physical therapy. I've achieved board certifications in both orthopedic physical therapy and sports physical therapy. So orthopedic is probably what you think about as physical therapy going into the clinic. You've had a surgery or you have an ankle sprain, low back pain, something like that. And then sports physical therapy has a lot of overlap with orthopedics, but it also includes things like sideline sports coverage. So while you have not seen me on TV running out to help an injured athlete, primarily my sideline sports coverage was high school sports. So I did a lot of football games, soccer games, those sorts of things at local high schools. And my sports background, I started as a runner, track and field, cross country, and then I moved over to cycling. And so the little dude on the left there, that's actually my son Henry. He's just getting into bikes, so that's fun, and I'm sure someday soon I'll be chasing him down. He'll be running laps around me. So all good. So first we'll get started with general principles here. If you're new to an activity, it's important that you start slow. And that's also true if you're coming back to an activity that you haven't done for a while. So, if you used to run a bunch or you used to cycle a bunch, that's great. You have some experience, you have some foundation that you've built in the past. That doesn't mean you need to jump back in at the same level that you used to do it before. That's probably actually a bad idea. You have to build back up a little bit, and lo and behold, if you've done it before, you have some memory, you have some experience. Your body's done these movements before, has some familiarity with it. You'll probably build back faster than somebody who's truly a novice and a first timer, but you still have to start a little bit slower. And the other piece of the puzzle is you're probably a little bit older than the last time you did it. And our bodies change over time. So the body you did it with, 5, 10, 15 years ago, however that may have been, is a little bit different than it is today for any number of reasons. And so it's just important to be mindful that as you start back into something, you don't go 0 to 60 right away. You use your body back into it and get comfortable with it. It's also important to warm up. So for whatever activity you're doing, and if it's cycling, easy enough, you get on the bike, whether it's a real bike or a stationary, and you start with some light activity for 5 or 10 minutes before you really get into the substance of the workout that you're trying to do. Similarly with running, you can walk or jog before you actually start to do running at a higher pace. You may also think about doing some dynamic stretching. So you're probably more familiar with the static stretching that maybe you did in gym class, bend down, touch your toes, those sorts of things. The long holds that you do, kind of 30 seconds maybe as you're stretching. Dynamic stretching doesn't have holds. It's dynamic movement. Maybe you've seen people at a gym, for example, walking across the gym and trying to kick a outstretched hand or sort of kicking their heels up to their buttocks. These are the sorts of dynamic stretches that you want to do. Sometimes you see people doing trunk rotations where they're turning their trunk as far as they can to either side. These are dynamic stretches, and these are the sorts of things that are going to prepare your body for movement, whereas the static stretching is going to be a little bit better on the recovery, so doing it after your activity. It's also important to understand that sore muscles are a normal part of working out to a point. So yeah, if you go and you do a vigorous workout, you might have sore muscles right after. That's totally fine. However, you might also have sore muscles a day or two later after you've done that workout. So take it with a grain of salt. It is okay. It is normal. It's a phenomenon we call delayed onset muscle soreness. So you have this soreness that actually peaks anywhere between 24 to 48 hours after you've worked out and may persist up to 72 hours. So keep that in mind, particularly as you're doing these new activities that your body's not used to. You may have the experience of delayed onset muscle soreness. And sometimes it's surprising because you say, well, I didn't work out yesterday. Why am I sore today? It's catching up with you from the day before, essentially. It's also important to think about your training progression. So as you go through and you start to train, you don't want to go just building up over time indefinitely. You actually want to start small and then build up in small chunks rather than building up in a sort of like steady progression. You also need to be mindful of any limitations in strength and flexibility that you have. So these can be risk factors that we can modify, and that's where PT can actually help. So myself and my colleagues can actually give you some pointers, some stretches, some strengthening exercises, these sorts of things that can help you avoid or reduce the risk of injury. Typically in the endurance sports, what we see, so cycling, running, swimming, as opposed to the field sports like volleyball, soccer, football, we see that excessive training or increasing the training load too quickly is one of the most common factors for injury. So with that, we want to make sure that we're, again, increasing this gradual progression. As a general rule, about 10% per week is a good rule of thumb when you're starting out. As you get to higher and higher levels or more and more training, 10% is a big, like actually a pretty big volume jump, but it does work pretty well when you're starting out. The other piece to remember is you want to incorporate recovery about every third or fourth week into your training program. So what I tend to do is 3 weeks I'll build up. So week 1, some volume, and then 10% more on that. Week 2, 10% more on that on week 3, and then week 4, taper that down a little bit. So you're maybe 35, 50% of the week 3 volume in week 4. What really happens with exercise is that your body needs to recover to respond to the changes. So if you consistently are adding more and more load, your body doesn't have the opportunity to recover and actually benefit from that training and exercise you've done. So it's important in that 3rd, 4th week to go a little bit slower, take it a little bit easier, and allow your body to recover and actually benefit and build itself stronger from the work that you've done. Okay, so we'll talk running now. A couple things. So running, shoes are the important equipment. Shoes are really the only equipment. Sure, there's fancy shorts and shirts and all those things that you can get, but truthfully, shoes are the equipment for running, and they're very, very important equipment for running. So if you look at your foot type, and everybody's got a little bit different foot, there's nothing wrong with one or the other. Like a neutral arch isn't perfect. We all have different types. Our anatomy is just a little bit different. And so it's important to think about a couple things as we go through this. So first off, do you have a neutral arch, flat, and high? Because shoes are actually built to match to the arch that you have. So if you go to a running store, they'll have a selection of shoes, and they're matched to the arch. Now, you may or may not know your arch type. The easiest way to do this is like if you're in a swimming pool or you're in a shower, somewhere where your foot's wet and you have a dry surface that you can stand on, you just step down with that wet foot, and you're going to get one of these imprints more or less. And that's going to give you some insight. And that can match then to this type of shoe that you want. And we reference pronation. It often gets a bad rap in running circles. It's really not a bad thing. Pronation is a natural movement that occurs at the foot and ankle to allow us to absorb shock. And the amount of pronation we have is somewhat associated with the type of arch that we have. So if you go to a running store, they're going to take a look at your foot shape, they're going to take a look at your walk. They're probably going to have you take off your old shoes and look at the wear pattern on your shoe. And then based on that, they'll be able to recommend an appropriate shoe for you to wear. So here's another chart here looking at this. And again, is it a cushion shoe, is it a neutral, is it a support shoe? These are what we're going to align with based on your foot type and sort of the alignment of your foot and ankle, to make sure we have the right shoe to reduce the risk of injury that you would have as you're running. So what about technique? What about running technique? How do you sort of reduce your risk of injury as you are running? It's interesting that the research actually shows with a shorter stride and a higher cadence, we reduce our injury risk. So with running, there's sort of 2 ways to go fast. We either increase our stride length or we increase our cadence. what the research is telling us now is that we actually need to focus on cadence to increase our speed before we do stride length, because that shorter stride length is associated with a reduced risk of injury. And really, when you talk about efficiency in running, it's really about how little you move your center of mass as you're moving forward. So naturally speaking, we sort of move in these sine waves. If you think about our center of mass, if you think about your belly button moving through space as you're running in a straight line. Really, you move up and down a little bit on each stride, and you actually move a little bit side to side as you shift from one leg to the other. Now, we want to minimize that movement. You're not going to be a rigid statue as you move through space, but if we can minimize that movement, that's actually going to reduce the risk for injury for you. So that's going to be the key, is what can we do from a strength, flexibility, stability standpoint. Also with the shoes, right? Make sure the right shoes and that contact with the ground is setting you up for success, to minimize the amount of deviation. Because if you have a large deviation, then you're going to be putting undue strain on tissues throughout the body. Okay, and then I'll go over to cycling. And so this probably doesn't surprise anyone with cycling, particularly if you look at people that are riding longer distances and thinking about riding on a traditional road bike with the drop handlebar. So knee pain is the #1 injury in cyclists. A lot of force is being delivered through the legs to move the bike forward. So, and the knee is one of the key joints. There's a lot of motion at the knee that's happening as you're cycling. And so that's also the most common reason that cyclists are missing time on the bike. So the most common reason that people take time off the bike is, my knee hurts, I don't want to ride. I think that intuitively makes sense to me. Again, back pain is right behind knee pain of 60%, but I don't know, you can tough it out. You can get through that. Whereas if your ability to move the pedals and move the bike forward is impacted from knee pain, then maybe you're less likely to participate and get on the bike. And next up is neck pain. And so you can imagine, again, depending on your position on the bike, how low you are, you have to look up, right? You have to be able to look forward and see where your bike is going. So if essentially the bike's not fit well, and you're looking up a lot to see where you're going, that can be a contributor for neck pain. And so that's the third most common injury that we see in cyclists. And I think what's interesting about a bike is that unlike running, unlike some of these other sports, unlike swimming, right? Swimming and running, for sure, you are free to move throughout space however you see fit, however your body sees fit. There's nothing really constraining you. Rowing and cycling, however, are more constrained. Like rowing, cycling really has 3 contact points. You have your hands on the handlebars of the bike, you have your bottom on the seat of the bike, and you have your feet on the pedals of the bike. And that's fixed. That's a fixed relationship. Rowing's a little bit different, because although you do have 3 similar contact points, you're actually allowed to sort of change the distance of your stroke. So there's a little bit more adjustment. Whereas the bike, you're on the bike, you're on that seat, and if the seat's not right, the handlebar's too high or too low or too far, you're in that position for as long as you're there, 30 minutes, an hour, potentially more, depending on how long you're riding for. So it's really important on the bike, more so I think than the other activities, that we make sure that you're setting yourself up in a position for success. So there's a couple things you need to know about fitting a bike, but it really starts with you, the user, the rider of the bike, and making sure we understand what are your strengths and what are your limitations. And then based on that, we can start to understand, how do we set up the bike to maximize your chances for success, your chances of enjoying the ride, and reducing the risk of injury. So there's a couple important things to take into account here. All right, so one is, how long can you do a plank for? Like you see here, this woman at the bottom of the slide. You want to be able to see how long you can do that. And the key is also doing it well. So either having a knowledgeable friend or other colleague, partner who can watch and tell you that you're keeping your form, or having a mirror to know that you're keeping your form correct for the duration. That's important, because it's not just to do the plank. Like if you can do a 90-second plank, for example, but it's of poor quality, that doesn't really count. That doesn't mean you're going to have the adequate core strength. Similarly, we want you to have good flexibility. Flexibility is a sort of underappreciated component of cycling. It's making sure you have adequate flexibility and mobility in the hips. And the easiest way to test that is actually just to touch your toes, or see if you can touch your toes. So there's essentially three different ways. Like either hey, look, some of us can touch the floor, some of us have never touched the floor, and that is perfectly okay. So maybe you can almost get down to your ankles, or maybe you get just past the knees or less. Based on this information, we can start to understand where we might want to get your seat height set up based on the optimal biomechanics for cycling. So 2 key points that really encompass the 3 contact points of the bike, right? The pedals, the seat, and the handlebar. So first is, what angle do we want the knee to be at the very bottom of the pedal stroke? And I'll also admit that PTs are a little weird in how we measure. We don't measure the way maybe you would think of the angle. So we look at a knee, so as you measure it from the ankle, the knee joint to the hip, and if that leg is straight, we as PTs call that 0. So that's kind of the reference point. And then as your knee starts to bend, moving your heel towards your butt, then we start to count up to about 150, 140, 150 is full range motion for a knee. So we want about, depending on this, 30 to 40 degrees of bend in the knee at the bottom of the pedal stroke. And then the other piece is the handlebar. Well, relative to the seat, once you get the seat figured out, how far do you want the handlebar to be below that? And that's really dependent on your core strength and your flexibility, the combination of the 2 pieces there. And there's nothing wrong with being outside those ranges. These are just suggested ranges. This is where people tend to find the most success, but you can, depending on your needs, your desires, you can have it higher or lower as you see fit. But that sort of requires somebody to look at you and measure. So how do you find the right seat height? This approach actually works quite well for, I'd say, 90+% of the population. So first thing you do, you gotta measure your inseam. And don't just go based on your pants size. That's not gonna do it. We need to be more precise. So you really need to measure from the length of the inner side of your leg all the way down to the floor when you're standing up straight. So that's gonna be the first piece of the puzzle. And then from there, there's a couple different ways that we can just use some math and some simple formulas to work out where should we place that seat. So the first one, what we do is we find the center of the crank arm. That's on the left image there, with the black and white. You find the center of that axis, the axis of rotation of the crank, and then you multiply your inseam measurement by 0.883, and that's the height of the seat that you want. That's one way to do it. The alternative way, I think, is sometimes easier because it's just easier to get to the bottom of the pedal and make sure that's consistent, is same inseam to start, and then you're going to measure it, multiply by 1.09. Now, if you do that, like I said, this should work for the vast majority of the population to get you really close, and then it's just going to be fine tuning from there to make sure that you get to the ideal level. But again, this is going to get you, I think, 90 to 95% of the way there for almost everybody in the population. And then starting with the level saddle, that's the way to go. Yeah, plus minus a degree or so works. But if you start to get more than a degree or 2 off of level, you're either going to feel like you're falling back off the back of the bike, or you're going to feel like you're falling forward and putting a lot of pressure into your hands. And then to get that handlebar height measurement, you just have to use a level from the seat across the handlebar and then figure out what that drop is, in centimeters or inches, whichever you prefer. So that's the quick high level. Let's do a little bit of discussion on how we at Omada for Joint Muscle Health can help you out here, and then we'll leave a few moments for Q&A before we wrap up today. So y'all may be familiar with Pizarra. It's a benefit you had in the past. We're still here. We just have a different name that changed on January 1 this year. So now we're Omada for Joint and Muscle Health. Interestingly, still the same URL. So the Physera.com/HP URL will still work and get you there. And so the key piece here, I think, is that you can schedule a visit with your PT, myself and one of my colleagues, typically within 48 hours. And so you have that video visit, we'll be able to assess your condition and work out what's the best plan of action for you. And then as we get you going, we'll actually send you a kit out in the mail. It has some TheraBands and other things in it to help you get going and work through your plan. And then through the app, you'll work with your PT to do exercises and activities to help your condition. And hopefully, if we've done it right, you'll be feeling better relatively quickly. So now a couple minutes here, and we can do some Q&A.
Todd, we do have one question from Wayne. Well, he has two questions. How often should one have a bike fit done? And two, after a 50+ mile ride, I just want to sleep. What is a good recovery?
I didn't catch the last bit. You said something about a sleep, and then it cut out for me.
Sorry. After a 50+ mile bike ride, I just want to sleep. What is a good recovery?
Got it. Okay. How often should you have a bike fit? That depends on how much you're riding. I think you can get a good baseline sort of doing it once, and then if you maintain your flexibility, you probably don't need to do it but every couple years, to be honest. If you have some dramatic changes, you have an injury, or you have different goals that you're trying to achieve, then you may want to think about doing it more frequently. I know at the highest level, professionals are like modifying their bike fit constantly. It's not necessarily static. They're changing it through even within the season. So it really depends on what your goals. But like doing it once, particularly if you're riding a lot, is important. On the recovery standpoint, I think two pieces here. So one, making sure that you're eating enough as you're out there riding those longer rides is an important piece of the puzzle, I think sometimes overlooked. So the current research is showing that we can consume between 60 and 90 calories in terms, or 69 grams of carbohydrates. So that's 240 to 360. I shouldn't do math like this. I think that's right. Calories per hour as you're riding to stay fueled. So that's one piece of the puzzle. I think the second piece of the puzzle is then after you get off the bike, making sure that you eat adequately. So trying to get the recommended ratio is 4 to 1 from carbohydrate to protein, really within 30 minutes of your riding, to start the refueling process, so that you can get back and be ready for the next thing that you're doing. But I think if you're feeling like particularly exhausted after the riding, it might just be a under fueling when you're out there versus necessarily changing your routine for recovery. And I'm a big fan of eating real food. So there's plenty of sports drinks and mixes and all sorts of things that you can do. But after you ride, if you're ending up at home, there's also real food in your refrigerator that has carbohydrates and protein in it that you can consume.
Todd, would you mind sharing these slides at the end? I think some of those numbers were really helpful for people that were tuning in. If it's just posted in the chat or something like that.
Yeah, is there an easy way? Let's see. I wonder if I can just, can I upload a file into the chat? I haven't done this before.
Yeah, you can.
Okay, let me stop sharing here. And I will. Relatively speaking, I'm a Teams novice.
We can do it at the end, like when we
Yeah,
hop
I might
off.
do it. Yeah, I can also send it to you.
Okay, yeah, that works great.
Yeah, Todd, if you can see the chat button, you would just paste it into the chat itself.
I see. Well, let me ask a silly question. I see the camera toggles. I see share tray. I see more actions, but I don't see a chat bubble or anything.
Okay.
That's
Yeah, it
okay.
would
We'll
be under
figure it out
menu.
after. So we have a couple other questions. Can Omada help with back to running plan after an injury?
Yeah, like a return to running protocol. Yeah, absolutely. That's definitely in our wheelhouse. We can get you set up on the right path to get back to running.
And then how many days a week should we run for fitness?
Oh, that's a tough question. I think it depends on what your goals with running are, right? If you're saying, okay, my objective is general health, that's one answer. And if my objective is to run the Boston Marathon or something, that's next week, then that's a different answer. And so if you're just looking for general health, if I'm not mistaken, the current recommendation is 150 minutes of exercise per week. That's moderate intensity. When you look at higher intensity like running, then it's actually fewer minutes. And so you can, with running, if you did 3 days a week, you would more than hit the mark. 4 to 5 would, again, depend on the volume, would probably be the most that most people are going to do. You're probably not getting to 6 unless you're really training for something. Are you going to be running 6 days a week? But if you did, for example, 30 minutes 3 days a week, that would be, from a fitness standpoint, like well within the guidelines that are issued out there right now.
And then Ruth had a great question. She says, I'm curious what whole foods you eat for fuel during running and after recovery.
So the difference between running and cycling is, of course, running, you're bouncing a little bit more. So it's a little bit harder to keep things, well, the stomach's just like less settled in running than it is with cycling. But cycling, I have a whole concoction of things that I eat. Bananas are on that list though, because they're easy. I'm also a fan, this is super simple, but if you take sushi rice and prepare it, and then I basically take sushi rice, put it into an 8x8, one layer of peanut butter, and then another layer of sushi rice, and it makes like a little rice cake. I'll pack that with me when I'm out cycling. So that works pretty well. In terms of afterward, I just make very simple smoothies. So I'll take, again, banana, whatever sort of milky beverage you like. I'm an almond milk person, but cow milk, oat milk, whatever. They all work equally well as far as I'm concerned. I'll take that, and then I'll get either some peanut butter, and then sometimes potentially some like plain yogurt or kefir, and then I will blend those all together and have that after I'm done riding.
Okay, thank you, Todd. Any last questions? We have about a minute left. All right, thanks, Todd. I can get the slides from you and I can upload it into the chat. I think that might be easiest, or I'll email it out to everyone that was on the call today. But thank you so much for just answering so many questions and presenting such a great presentation. We really loved having you.
Yeah, you bet. I'll send you both weeks' slides so you have them.
Okay, thank you so much.
All right, you bet. Take care. Thank you.
Thank you.
Thank you.